Thank you, Vera. And thank you again to Dr. Galan and Mr. Garganta for their fascinating talks. We have a few questions in. So the first question is, are all 3 LitControl versions available on prescription in the NHS? And is the pH meter available on prescription on the NHS?
Okay, so I might answer that. So at the moment, everything is available through the Premier Wellbeing website. And in terms of being available through the, we'll say free, it's not free because it's a food supplement, it's not a drug per se. So both in the south and in the north, it's available and available through all the retail pharmacies as well as on the Premier Wellbeing website. However, it's not free to patients. They have to pay for it themselves, which is a bit of a pity, but it'd be nice if they could get it free. But it's not categorized as a drug. It's categorized as a food supplement, but it's fully available.
Okay, thank you. Is there a role for pH down as prophylaxis after PCNL for Staghorn stones to prevent recurrence?
Antonio, maybe I can answer. Okay. Yes, this is the main target. So when you have an Staghorn stone, first of all, you need to remove it with a procedure. But after that, the guidelines recommend antibiotic and L-methionine. So LitControl pH down can be effective in this type of patients.
Okay, excellent.
Well, sorry, may I add something? That will be if the Staghorn stones, we consider that an infective stone. Of course, you can have Staghorn stones not composed of struvite. And maybe you can use some other products too in this patient.
And in that context, then, is it also for 6 months or for how long?
Yes, but it depends, because you will keep on following the patient in the office, and you can see how they're doing. Maybe you can have some residual fragments, and maybe you want to keep the medication, the products for longer. If not, it's not really necessary longer than that, but it should be admissible, and it will depend mostly on the past history of the patient and how recurrent he is or she is.
Okay. Can LitControl be used as dissolution treatment when stones are already present, or has it just got a role in prevention?
I can answer that, and maybe Juan Antonio can add something. No, LitControl is not intended for dissolving stones. The only stone that we can dissolve is uric acid 1, when it's a small uric acid stone and taking probably more than 2 capsules per day of LitControl pH up. Okay, because in this case, what we want to provide is a lot of alkali power to try to dissolve these stones. The rest of the stones cannot be dissolved with our products and without any other product of the market. So you need to remove it when you have the stone with a procedure.
Well, nothing for the moment can dissolve calcium stones, and there's been some tries quite long ago, but doses of the products to use were too high, and they were too toxic to take the step and use it in humans. They were not even considered for that. As Rosendo said, for uric acid stones, you can use it. For small stones, and also depending on the structure, the internal structure of the stone, because there are some uric acid stones that are compact and some others that are a different structure. It's like hollow in the middle, or it's like a beehive or something like that. And in some cases, you can try to dissolve these uric acid stones with double dose. More than that, 6 capsules a day.
And okay, we've just about come to the end of our time, but I want to ask one more question. Obviously, one of the things that has transpired from COVID-19 is with a lot of associated delayed surgeries and deferred surgeries. And this sort of highlights the importance of prevention, particularly of stent encrustation. And I know certainly in my practice, I've noticed an increase in patients presenting with crusty stents from delays in surgery. You talked about stone encrustation prevention and the choice based on baseline pH greater than 6.2, choosing pH down, and baseline pH less than 5.5, choosing pH up. Is that regardless of the stone type and just based on pH alone? Would that be how we would choose the type of LitControl?
The Prevent Lit study was designed. We needed to gather patients with known past history of uric acid or calcium phosphate or calcium oxalate dehydrate with high pH, higher than 6.2. In that study, we didn't gather any struvite stone patients, for example. There have been other studies afterwards, like the one I presented you. That's another cooperative study in Spain, dealing with encrusted, not encrusted, in order to show the prevention of the incrustations in infection stones. So it's not, it depends, of course, of the composition of the stone, but normally it goes related to the urine pH. You can use, as you said, the incrustation is a very common problem, more nowadays with the COVID pandemics, and patients we could solve in the OR within 20 minutes. We now need more than 90 or 2 hours. They are really terrible cases now. And of course, we always recommend, I always do, and as a referral center, we get patients for percutaneous surgery or endurologic surgery, and also for shockwave lithotripsy. I always beg, not recommend, but beg to my colleagues to use these products to try to avoid incrustations.
If we have time for one more question, Rosendo, I want to ask you just about, you talked about regulation of urinary pH used in conjunction with various antibiotics in order to reduce antibiotic resistance. Does the use of these LitControl products also have an effect in the efficacy of these antibiotics in treating infections?
Yeah, good question. There are some doctors that are using in their practice LitControl pH down, for example, to reduce the pH in combination with nitrofurantoin or fosfomycin. But today we don't have data. What we have is the data of different antibiotics at different levels of pH, and we have seen that these particular antibiotics in a lower pH increase their activity because of the reason that I mentioned before, because they change the bioactive form and they can penetrate better in the cell membrane of the bacteria. So yes, if the LitControl pH down can decrease the pH, you can use it in combination with this type of antibiotics. And if you want to use quinolones, for example, you have to increase the level of pH, and you can use an alkalizer like LitControl pH up.
So once again, I would like to thank Dr. Galan and Mr. Gaganza, and obviously Vera and her team at Premier Wellbeing for hosting this event.